Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If you have hand pain, especially from carpal tunnel syndrome, then you know what the symptoms are. Your hand hurts, your fingers are tingling, they may be numb. It's very difficult to do any work like typing or using your hands for your everyday chores. And maybe your numbness and tingling is waking you up at night. You've probably also visited your doctor who confirmed your diagnosis of carpal tunnel syndrome. Your doctor probably also informed you that the way you treat this is up to you, and that he probably suggested you have surgery for your carpal tunnel syndrome. But your doctor likely didn't tell you that most people who have carpal tunnel surgery are dissatisfied with their results, while the vast majority of sufferers who use non-surgical therapy are quite satisfied with their results. These simple yet highly effective non-surgical therapies are resting your hand, using a night splint, and wrist and forearm deep tissue massage. The first one, rest, means just that. It means not doing anything with your hands to stress them or strain them during the day. It also means that you can't just put a splint on your wrist and then go about your activities that cause strain to your hand. Next, you should splint every night while you sleep, and only sparingly during the day when you're awake. Night splinting keeps your hand from bending and twisting, further aggravating your condition. Finally, get professional deep tissue massage of your wrist and forearm. In fact, deep tissue massage is nearly 100% effective in relieving carpal tunnel syndrome, but only if it's done daily and for a period of 2 to 4 weeks. But this isn't your everyday massage. It requires specific motions on the wrist and forearm that over time will drain excess fluid, break up adhesions, and enlarge the carpal tunnel. That reduces inflammation, swelling, and pain, and ultimately your carpal tunnel syndrome. Discuss these highly effective non-surgical therapies with your doctor, and make sure your doctor discusses the fact that most people who have surgery are dissatisfied with their results, while the vast majority of those who use the non-surgical therapies described here are quite satisfied with their results. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Once again, those non-surgical treatments that everyone should use first are resting your hand, splinting, especially at night, and deep tissue massage, which is almost 100% effective in relieving symptoms. But it must be applied professionally and every day for at least 2 to 4 weeks. Anything less or improperly applied is useless. And to get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.